I'm Alan Lemley. I work for Syracuse Orthopedic Specialists. I specialize in care of the hand, wrist, and elbow. I grew up on Long Island, about halfway east from New York City out to the tip in Suffolk County. I haven't been back there since I graduated high school. I've gone off to school and been back to visit my parents a time or two, but other than that, busy taking care of people and living here in New York. My undergraduate training was at Dartmouth College. I was a biomedical engineering major. After 4 years there, then I went to Upstate Medical University, and that's where I kind of got to know the Syracuse area. Been there from '99 to 2003, and then after that went off to residency in West Virginia in Morgantown. I was there for 5 years, and then after that I did an additional year training in hand and upper extremity surgery at University of Pittsburgh. My treatment philosophy in caring for patients is that everybody gets treated the same and equally from the moment they meet the door. I kind of go in with no preconceived notions, whether you've had MRIs or nerve studies or other things that you've had done previously. I just want to know what symptoms you have, how they're troubling you, and sort of start from the beginning to try to figure out how can I help you. The things that initially drew me to orthopedics was certainly a combination of interaction with people, combining things that I like, engineering and understanding how things work, as well as the medical side of things. It sort of all got a little bit of everything in there. And while engineering was interesting in terms of figuring out how things work, there wasn't really enough people component in terms of talking to people, and that's what I missed when I was doing the engineering. And so by keeping medical school open all along during college, that's what sort of led me into medicine, and from there into orthopedics. So the decision to go into working on hands, elbow, and wrist surgery is really that I like the anatomy, that I like the intricacy of the parts that I'm working with, and everybody has a need for their hands working. If it's somebody that works just with their hands or somebody that doesn't, you're still using your hands all the time, and so and that's what kind of differentiates us. It's what makes us humans. Is that we need our hands to be able to do the things that we need to in life, and so that's really the thing that brought me back into the hand. Just because we're surgeons doesn't necessarily mean that the reason you're coming to us means that you need a surgery, and so there are times that really what you need is good therapy or a cortisone injection, or being told that what you have is normal or it doesn't need to be fixed. And so that's the most important thing, is that while I look at you from a surgeon standpoint, it doesn't mean that all I want to do is operate on you. It's that if you need that, I will step in and decide that that's the right thing to do. But if not, then that's where we try the conservative options that we have. And with SOS, it's nice because then if we need to get you to therapy, we can do that. Or if you need some other piece to get you better, we can work on getting that done as easily as possible. Certainly my favorite part is where somebody comes up and thanks you. If it's somebody that's you've helped either recently when they're leaving the office, happy that you've taken care of them, or if it's somebody that you're out walking around Syracuse and they come up to you and say, "Hey, Dr. Lemley, do you remember me? You fixed my wrist," and that's always something that makes you feel good. Or if somebody comes in and says, "Hey, so-and-so sent me to see you because they said they helped you. Could you help me?" So those are the things that make me happy to do what I do. I think that Syracuse Orthopedic Specialists really does do a good job in terms of trying to take care of people and get the right person to do the right job. And sometimes that frustrates people that I might not be taking care of their knee, but if I can send them to somebody that's going to do a better job with their knee, then I'm going to do that. And we've got enough pieces in place here in the Syracuse community that if you need therapy, we've got top-rate therapists. If you need surgery, we're going to do it at our outpatient surgery center, where all we do is orthopedic care. If you need an MRI, we can do these things so that it's not a lot of work for the patient to get what you need, that we can usually coordinate and make things work well for the patient's best interest. I lived here in Syracuse for 4 years during medical school, and certainly it was a place that I could see raising a family. And then when my brother joined the group and was very happy here, then that was certainly a large influence in terms of why I came back. And it's nice because when I see and do my job every day, all I have to do is take care of patients, and all the other pieces are in place, so I don't have to worry about getting an authorization for an MRI or things like this, that there are other people that can always do the behind-the-scenes work and make my job easy. So all I can do is just take care of patients.